The hospital's cardiothorac unit was a world of hushed urgency and controlled chaos. Dr. Eris Thorne, a surgeon whose reputation preceded him by a hallway, was its undisputed king. He was a man of 45 with hands that could restitch a heart as easily as a tailor mends a coat. He was also, at this moment, a man on the brink of panic. "We're losing him." The anesthesiologist, Dr. Lena Petrova, cried out, her voice tight with fear. The patient, a young man named Ethan, was on the operating table, his heart exposed to the sterile air. A massive, unstable clot had ruptured in his left ventricle. A complication so rare and so catastrophic that Eris had only ever seen it in medical journals. The monitors were screaming, their shrill beeps a countdown to disaster. "Get me the ventricular clamp." Now, Eris shouted, his hands hovering uselessly over the patient's heart. "I can't stabilize it. The tissue is too weak. The sutures won't hold." His face, usually a mask of stoic professionalism, was now a portrait of stark terror. He was a master of his craft, but this was a scenario for which there was no textbook solution. Every option he ran through his mind was a dead end, a path that led to the death of his patient. The scrub nurse, a young man named Ben, frantically fumbled for the clamp. His hands, usually steady, were trembling. The air in the operating room was thick with the scent of antiseptic and the palpable fear of a team facing a losing battle. Amidst the frantic energy, there was one person who remained perfectly still. Her name was Clara Finch. She was a 50-something surgical nurse. A woman with a quiet demeanor and a kind face that seemed to have seen a great deal of life. She had been a part of the staff for over 10 years, a dependable and efficient presence who was a constant in a world of change. She was the one who could find a missing instrument without a word, the one who remembered the small details that everyone else forgot. But she was just a nurse, a part of the supporting cast, never the lead. Eris, in his desperation, saw her standing at the periphery, a silent sentinel. "What are you staring at, Clara? Get me the fibrin sealant. Maybe we can buy some time," he barked, his voice laced with frustration. Clara didn't move. Her gaze was not on him, but on the patient's heart. Her eyes, usually so soft, were now sharp, analytical, like a hawk spotting its prey from miles above. The team froze, their attention drawn to her. This wasn't the quiet, unassuming Clara they knew. This was someone else entirely. "The sealant won't work, doctor," she said, her voice surprisingly strong and calm. "The tissue is too necrotic, it won't adhere, the pressure will blow it right out." Eris stared at her, his mouth agape. "And what would you know about it? Get back to your post." "I know," she said, her voice unyielding, "that you have less than 60 seconds before that ventricle tears completely. You need to use the pericardial patch, not a synthetic one, a live tissue graft. And you have to do it with a running suture, not an interrupted one. The interrupted will cause too much stress on the weakened tissue." A hush fell over the operating room. The monitors continued their frantic beeping, but the human element had stopped. They were all staring at Clara, this quiet nurse, who was not only contradicting the head of surgery, but was suggesting a complex, improvised surgical technique with an impossible level of detail. "Are you insane?" Eris finally spluttered. "I can't just take a pericardial patch and what? Do a live graft on a beating heart. The risk of embolism is astronomical. The patient will bleed out." Clara took a step forward, her movements deliberate and controlled. The risk is a certainty now, Doctor. Your current course of action will kill him. My way, he has a chance. A small one, but a chance nonetheless. She didn't wait for his permission. She moved to the supply cart, her hands a blur of motion as she selected a second, smaller scalpel. She grabbed a pair of forceps and a delicate curved needle with a microscopic thread. She had chosen her instruments with the speed and precision of a master craftsman, not a nurse. She then did the unthinkable. She moved Eris's hands out of the way, her touch firm but respectful. He was so stunned, so paralyzed by her audacity, that he didn't resist. He simply stared as Clara took his place at the operating table. The anesthesiologist, Lena, finally broke the silence. "Clara, what are you doing? You can't perform surgery." Clara didn't respond. Her focus was absolute, her world reduced to the patient's heart and the tools in her hands. With a steady hand, she made a small incision in the patient's pericardium, a membrane sac that enclosed the heart. She then, with an almost supernatural grace, sliced a small, perfectly shaped patch of tissue. Her movements were not the hesitant fumbling of a novice. They were the fluid, confident motions of someone who had done this 1,000 times. She then placed the patch over the ruptured ventricle. The blood, which had been a torrent, was now held back by a tiny living wall. The heart, which had been spasming in a desperate rhythm, began to beat with a more regular cadence. The monitor's frantic beeps became a steady, reassuring tone. The team stared, their disbelief turning to a kind of horrified fascination. This was not just a surgical technique, it was an act of impossible genius. It was like watching a painter create a masterpiece in a single stroke, or a musician play a concerto on a violin they had never touched. Clara's hands, which everyone had seen pass instruments 1,000 times, were now doing the impossible. She was performing a complex, improvised heart surgery with a skill that rivaled, and in this moment, surpassed their own. She was stitching the living patch to the heart with a running suture. Her movements so precise and so fast that the human eye could barely follow them. She was a machine, a force of nature. The lead scrub nurse, Ben, finally found his voice. "Her technique, I've never seen anything like it. The anastomosis is perfect." Lena, the anesthesiologist, was equally stunned. Her hand-eye coordination, ... It's beyond belief. She's not even looking at the monitors. She's working from touch, from instinct. Aris, the great Dr. Aris Thorne, was standing in the corner of his own operating room, watching a woman he had dismissed as a simple nurse perform a surgery he had deemed impossible. He was watching his patient's life be saved by a person he had never truly seen. His arrogance, his pride, his entire sense of professional superiority was crumbling to dust. The surgery lasted for another 30 minutes. Clara didn't stop, didn't falter, didn't lose her focus for a single second. She worked with a quiet, efficient intensity that was both terrifying and beautiful. She was a surgeon, a doctor, a genius, and a nurse all at once. And when she finally finished, when the last suture was placed and the heart was beating strong and true, she stepped back, her face finally showing a hint of exhaustion. "He's stable," she said, her voice a whisper. "He'll make it." The team stood in stunned silence. Eris was the first to move. He walked over to her, his gaze full of a profound humility. "Clara," he said, his voice hoarse with emotion. What did I just see? What did you just do? Clara looked at him, her kind face now etched with a quiet sadness. I did what was necessary, doctor. It was Dr. Petrova, the anesthesiologist, who finally pieced the puzzle together. She had seen a photo in an old medical history book. A black and white image of a young woman standing proudly in a surgical gown, a medical team around her. The photo was a relic from a different era, a time when women were just beginning to break into the male-dominated field of surgery. Dr. Thorne, she said, her voice full of a sudden, deep respect. Do you remember the story of Dr. Clara Finch, the prodigy, the one who pioneered the live tissue graft technique in the 1980s, the one who was a surgeon's surgeon, a legend in her time? Eris looked at Clara, then back at Lena, a dawning horror and understanding on his face. The one who disappeared from the medical world 30 years ago after a failed surgery. A child's heart, I think. Lena nodded slowly. Her name was Clara Finch, a pioneer, a genius. A person who wrote the book on what we just saw. The story, a tragic and celebrated tale in the annals of St. Jude's, was of a brilliant surgeon who had lost her nerve after a child's heart, a child she had promised to save, had failed on her table. She had disappeared, leaving behind a legacy that was both celebrated and mourned. Clara, the woman who had been a quiet nurse for 10 years, was that legend. She had been here all along, hiding in plain sight, a surgeon's hands wrapped around a simple, unassuming life. The trauma of that failed surgery had left its mark on her. A profound guilt that had driven her to a life of quiet service, a way to atone for a life she couldn't save. But today, a young man's life had hung in the balance, and the surgeon in her had been reawakened. She had seen the impossible, and she had done the impossible. The staff, who had frozen in shock, now looked at her with a newfound reverence. A profound respect for the woman who had not only saved a life, but had also revealed a ghost from the past. Clara looked at Eris, a simple nod passing between them. He understood now. He understood the skill, the precision, the sheer genius that had saved his patient. He had thought he was a god in his own domain. But today he had been a witness to a miracle performed by a woman he had never truly seen. He had a lot to learn, and he had a feeling his new teacher would be a nurse with a kind face and the hands of a legend. The aftermath of the surgery was a surreal blur. Clara, once the background character, was now the center of a stunned, whispering crowd. The head of hospital administration, Dr. Marcus Thorne, Eris's father, and a formidable figure in his own right, arrived minutes after the surgery concluded. He took one look at his son, pale and humbled, and then his gaze settled on Clara. He hadn't seen her in decades, but he recognized the hands that had once worked with his own. He simply nodded, a silent acknowledgement of the legend standing before them. The patient, Ethan, was moved to the ICU. His condition was guarded, but stable. The crisis was averted. The impossible had been done. Later that evening, in a small, quiet conference room, Eris sat across from Clara. The air was heavy, not with the tension of the operating room, but with the weight of unspoken history and a profound sense of awe. The rest of the staff had been dismissed, leaving the two of them alone. Why, Eris finally asked, the single word carrying a universe of questions. Why did you stay? Why here? Why a nurse? Clara looked down at her hands, the hands that had just performed a miracle. They were still the hands of a nurse. but they held the memory of a surgeon's past. "After that child, the one I couldn't save," she began, her voice soft, "I broke. I had promised his parents, promised myself, that I would save him. I was so young, so arrogant. I believed my skill was enough, but it wasn't. The trauma of his loss, it was like a black hole. It swallowed my confidence, my passion, everything. I couldn't face another operating room. I couldn't stand the thought of holding another life in my hands, knowing I might fail again." She paused, taking a deep, shuddering breath. "I ran. I changed my name. I came here, to a place where no one knew me. I wanted to stay in medicine, to be close to it. But I couldn't be on the front lines, being a nurse. It was a different kind of service. It was about being a part of the team, supporting, but never being the one who had to make the final, terrifying decision. It was a safe place to hide." Eris listened, his own arrogance dissolving in the face of her vulnerability. He saw her not as a legendary surgeon, but as a human being, haunted by a past mistake. "And today?" he asked. "Why today?" "Today," she said, looking him in the eye, "I saw you. I saw the same arrogance I had. The same belief that skill and knowledge were enough. But when you were faced with the impossible, you were just a man, terrified. And I saw Ethan, so young, so full of life, just like the child I couldn't save. I couldn't let it happen again. My guilt, my fear. It couldn't be bigger than his life. So, I pushed through it." Eris nodded slowly, a profound respect blooming in his chest. "You saved him. You saved me too. You taught me that there are limits to what a textbook can teach you. That sometimes, experience and instinct are everything. And that sometimes, the person you think is a nurse is the best surgeon in the world." The next day, Eris sought out Ethan's parents, a young couple who were holding a vigil by his bedside. They were exhausted, their faces etched with the strain of the past 24 hours. "He's going to be okay," Eris told them, his voice gentle and humble. The surgery was a success. The mother, her eyes red from crying, reached for his hand. "Thank you, Dr. Thorne. Thank you so much. You saved our son." Eris didn't correct her. He simply looked at them, a small, sincere smile on his face. "I was only a part of it. There was someone else. Someone who made the impossible possible." He gestured toward Clara, who was at the nurse's station, quietly charting the patient's vitals. She was a nurse again, a part of the background, but she was different now. She moved with a quiet confidence that wasn't there before. The couple followed his gaze. They saw a kind-faced woman with a gentle smile, a woman who looked like she had a story to tell. They didn't know her name or her past, but they knew, instinctively, that she was a part of the reason their son was alive. For the rest of his tenure at St. Jude's, Dr. Eris Thorne's operating room was a different place. The hushed urgency remained, but the controlled chaos was replaced by a collaborative respect. He no longer barked orders, he asked for opinions. And more often than not, he would ask for Clara's opinion first. He had learned that the person who seemed to be just a nurse might have more to offer than he could ever imagine. The legend of Dr. Clara Finch, the surgeon's surgeon, was no longer a ghost from a past generation. It was a living, breathing reality, a quiet, kind-faced woman with the hands of a genius and the heart of a saint. And in the steady, rhythmic beat of a young man's heart, she found a new kind of peace, a new kind of purpose. The guilt was still there, but it was no longer a black hole. It was a reminder, a lesson learned, and a promise kept. She had been given a second chance, not just to save a life, but to save herself. And she had taken it,